PGT is a technique that means pre-implantation genetic technique. In this, we can screen all the embryos before the implantation is done, and it is a very important breakthrough for all the females who are suffering from either recurrent miscarriage, recurrent IVF failure, or having a previous history of child with any genetic anomaly. And there are many genetic anomalies right now that can be seen, that can be diagnosed through PGT, and so the patients don't undergo the trauma of embryo transfer, then subsequent the trauma of abortion during pregnancy, and subsequently having a genetic anomalous child and bearing the financial and emotional burden of upbringing a genetically anomalous child. You must be listening to many news channels and everything. In that, you listen to many news that parents are they are going for funding, they need help because they want their child to be cured because some injections that is causing birth in lakhs. So with this new technique, many such patients, they can really benefit from this. So basically, PGT is done in all patients who are having recurrent miscarriages and in recurrent IVF failure also. So it benefits these patients because when in recurrent abortion, what happens that naturally there is God gifted that 90% of the embryos that are bad, that are eliminated. So we come to know that okay, this patient is making only anomalous embryos, or something can be done about these embryos. Or in patients with recurrent IVF failure, many times what happens, the patient comes to the OPD and tells us that look, I am making blastocyst in all the cycle, but still there is no result. So in these cases also we can do PGT, and the best embryos that are PGT, that have the PGT has been done, and those embryos that are normal, they are then subsequently transferred in the womb. And there are two techniques of doing PGT. We can do invasive as well as non-invasive PGT. Non-invasive PGT has come as a boon because in those cases embryo biopsy is not required, and so there is no cutting or anything on the embryo, and patients feel more comfortable if we counsel them for non-invasive PGT. So PGT is a boon for all these patients, and they can have a healthy child, and they can not suffer the pain of having recurrent embryo transfers in their womb, and subsequently saving the financial and emotional burden on the couple and to the whole family as a whole. We care about you.